Hey there, and welcome. Every medicine you take, whether it's a simple aspirin or a life-saving antibiotic, really has two stories. It has a journey and it has a mission. Today, we're diving into pharmacotherapeutics, which is just the fancy science that uncovers that exact story, revealing how a drug is made and, more importantly, why it was prescribed for you.
I mean, really think about it. How does a simple leaf from a plant turn into a precisely engineered life-saving pill? This one question pretty much bridges all of human history with the most cutting-edge technology. And that journey is the first half of the story we're exploring. So let's start with the basics. What exactly is this field? Well, you can think of it as uncovering the logic and the strategy behind every single prescription your doctor writes. At its core, pharmacotherapeutics is simply the science of applying drugs to help people. It's the crucial bridge, right? It connects a drug's chemical properties to its real-world clinical purpose, which is always to prevent, diagnose, or treat a disease. To really wrap our heads around this, we're going to tackle it from two angles. First, we'll look at the origin story. Where do our medicines even come from? And second, we'll get into the strategy. Why does a doctor choose one specific drug for one specific reason over all the others? So let's kick things off with that origin story. The history of where we get our medicines from is, well, it's really the history of science itself. It's a journey from the natural world all the way to the high-tech lab. This timeline shows a really clear evolution. For thousands of years, our pharmacy was basically just the natural world, plants and animals. Then we started tapping into minerals and even microorganisms. And today we're in an era of pure creation, designing medicines from scratch using synthetic chemistry and even rewriting DNA. Each of these steps was a massive leap forward in our ability to heal. The natural world is, and honestly has always been, an incredible source of medicine. We get powerful painkillers like morphine from the opium poppy. We get substances like the blood thinner heparin from animals. We use simple minerals like iron to treat deficiencies like anemia. And of course, the world was completely changed forever by the discovery of penicillin, an antibiotic that comes from a fungus. And this brings us to a really crucial turning point. You see, while natural sources are powerful, they can also be inconsistent or have impurities. Lab-created or synthetic drugs solve that problem. They give us unmatched purity, perfect consistency, and the power to actually design molecules that minimize side effects. And that's exactly why they now dominate modern medicine. This is what I mean by the rise of the lab. Most of the drugs you're familiar with, like aspirin, are fully synthetic. They're created from scratch. Others, like the antibiotic amoxicillin, are what we call semi-synthetic. That just means we take a natural substance, like penicillin, and we tweak it in the lab to make it even more effective. And this brings us right to the cutting edge. Using something called recombinant DNA technology, we can essentially give new instructions to cells, turning them into microscopic drug factories. So we can program bacteria to produce perfect human insulin, or use mRNA technology to create revolutionary vaccines. This is a whole new frontier of medicine. It's amazing. Okay, so now that we know where drugs come from, let's tackle that second big question. Why are they prescribed? Think of this as a doctor's strategic playbook with 7 distinct goals of treatment. 7. That's the magic number. Every single prescription ever written falls into one of these 7 categories. Understanding them is kind of like understanding the different plays a doctor can call, each with a very, very specific mission. So the first goal is acute therapy. This is for medical emergencies. We're talking about sudden, severe, and often life-threatening situations where you need an immediate and powerful intervention right now. A perfect and pretty dramatic example is using an EpiPen, that's epinephrine, to stop anaphylactic shock. The goal here isn't long-term management, it's immediate survival. That is acute therapy in a nutshell. Next up, we have maintenance therapy, which is pretty much the exact opposite of acute care. This isn't for a sudden crisis, it's for managing a chronic long-term condition. The goal isn't a cure, but to stop a disease from getting worse. Just think of the daily medications that millions of people take for things like high blood pressure or high cholesterol. These drugs are taken for years, sometimes for a lifetime, all to maintain health and prevent future problems like a heart attack or a stroke. All right, this slide here lays out the entire playbook. We've covered acute and maintenance, but let's quickly walk through the others. Supplemental therapy is just what it sounds like. It replaces a substance the body is missing, like insulin for a person with diabetes. Then there's palliative therapy, which is focused purely on comfort and symptom relief,
like providing powerful pain medication at the end of life. Supportive therapy helps the body's functions while it recovers. Think IV fluids for dehydration. Prophylactic therapy is all about preventing illness from ever starting. The ultimate example of this, vaccines. And finally, you have empiric therapy. This is basically an educated guess. When a doctor treats you based on the most likely cause, like giving you antibiotics for a suspected infection before the lab tests even come back. The key thing to remember is that every single prescription has one of these highly specific missions. So let's put it all together. We've looked at the two core parts of our story, the journey of a drug from its source and the specific purpose behind its prescription. And this is really the heart of it. Every single medicine combines an origin story with a mission. It could be a drug from nature, like morphine, used for an acute mission to stop severe pain. Or it could be a drug from cutting-edge DNA tech, like insulin, on a supplemental mission for life. The source and the goal are always connected.
So the next time you look at a medicine bottle, don't just see a pill. Try to see the story inside. Is it a synthetic drug on a maintenance mission meant to protect your health for years to come? Understanding that journey and that purpose doesn't just demystify medicine. It actually empowers you. Thanks for watching.